When it comes to causes of jaundice in children, we can divide it into the age group, because that will make it easy for you to understand for which exactly jaundice you should be worried about. For example, we'll make it as a causes of jaundice in newborn and causes thereafter, like 2 months and infants and children. Children means 1 to 5 years of age. So when it comes to newborn, we can definitely talk about the birth jaundice. See, it's very common to have jaundice in newborn. It is not infective jaundice at all. That is one myth which we need to clear. Second, it is not caused because of any yellow clothes or any maternal eating problems or anything which the mother is wearing, etc., etc. It's absolutely happening because the babies have little higher hemoglobins. So where the hemoglobin will go, when it gets disintegrated, the byproduct of hemoglobin is jaundice. So in a layman's language, it is actually what is something like a kachra. So that gets piled up, and when it goes little excess than compared to the day of life of the newborn, then we would like to treat it. In general, the best what we talk about is the sunlight. Apart from this, newborns also suffer something we called as a persistent jaundice. Jaundice जो हमारा physiological है, but it's becoming common, and it is there even after 14 to 15 days of life. So there we would like to see whether it is any liver related issue, any other genetic cause, etc. So that is the time when you have to meet your pediatrician when you see your baby yellow, still yellow, after day 14 of life. Now when it comes back to 2 months to 3 months of age and above, when that jaundice happens, generally it is more related to the liver problems, and you need to check the LFTs, you need to consult your pediatrician and ask about it. Apart from that, when it comes to the pediatric age group, 1 to 5 years of age, the commonest cause of jaundice is what is generally because of contaminated water, which is a viral disease. We call it hepatitis A. This is most common. Other hepatitis viruses like B, C are also there, but they are not so common in children. The other causes of jaundice, which also, of course, of the liver origin, they will be even typhoid fever. In certain types of dengue fever, complicated dengue fever, tropical fevers, you can see jaundice. See, jaundice is yellowness of the body. So first jaundice symptom you will see in the eyes, the white part of your eye turns to a little yellow in color. Apart from that, there is also yellowness of skin, yellowness of your say tongue, the lower part of the tongue, but that you will see when you're observing very closely. And sometimes if the jaundice is very heavy, then also you will see the nails turning yellow. But by the time it's quite progressed disease, so I think anybody can pick it up when there is an excess yellow urine or a yellow discoloration of your white part of your eyes. Jaundice does not spread by hand to hand. If we are talking about an infective jaundice, which is generally because of contaminated water or food, then it is the food or the contaminated water which is the source. So that water getting supplied to those many people, they are at risk for developing the jaundice. Example, we always call it typhoid Mary was an example. For example, that she was the cook and she was infected herself with typhoid. So when she made food for others and she was not hygienic enough to wash her hands, then that time the typhoid spread through food to many people. So likewise, it's a common source. It will not spread because of your touch per se. So again, when it comes to treatment, we can divide it into the newborn jaundice and the infant and pediatric. So in newborn jaundice, definitely sunlight is the best therapy. Again, it also depends upon the risk factor. For example, children, or the newborns who are having G6PD deficiency or having blood group discrepancy with their mothers, there you will have excess jaundice. So in that case, you require phototherapy other than sunlight. So for that, we generally advise for an admission in an ICU where we give phototherapy through blue lights. Nowadays, they also ask us about home therapy if can be given. But see, giving blue light is not an easy thing. It is not just the light. The babies also get dehydrated. So the baby should be under the care of a doctor in those times. When it comes to the persistent jaundice in a newborn, again, we have to find out the cause, and accordingly the treatment will be there. And when we are talking about the infective causes of jaundice, it will be more about the treatment, which you have to see your physician or pediatrician, and they will be giving you medicines and liver protective drugs. First is vaccination, supremo. If you should get vaccinated with hepatitis A, there are 2 vaccine doses, 6 months apart. Generally, we routinely give it at 1 year of age and 18 months. Also, hepatitis B is a compulsory vaccine, of course, and people who have missed it or who are in an adolescent age group can retake the dose of hepatitis B vaccine. There is right now no vaccine for hepatitis C, but again, that's not a very common problem in pediatric age group. So, vaccination is the first prevention. Second, during the rainy season, one should avoid eating outside, and because the food is likely to be contaminated. When you're traveling to a newer state, you should avoid directly having street food, etc. And then that will be very helpful.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.